Now, Dr. Castrellon, you brought a model of a face.
Yes, I did.
It can't get any more real than that. I mean, you could have used mine, but we brought a face.
Yeah.
Let's bring it out.
Here we go.
Now, using this model, I want you to show us what are some of those common areas that we look at. And let's start with the forehead.
Yeah.
And the eyelids.
So I think one of the important things, Kathy, that what we see is, and there's things that are going to happen as we age. You know, the soft tissues and even the bone will reabsorb. So actually, it's good that we see here. As we age, also the bone is changing. The soft tissue and the skin is changing. And you can see this also tell you there's soft tissue. It's not only skin. So this will change and start atrophying. And what will happen is, as these tissues start atrophying, you'll have a laxity and the skin will start falling. So the eyebrow will start falling, and then that gives the impression that as your eyebrows start descending, that your eyelids are also descending and that the skin accumulates. So that is kind of a common thing. And then you start having crow's feet as well for the area of the forehead. So it's usually the eyebrows descending. There's also fine lines, the rhytids that you start seeing, which rhytids or wrinkles in the forehead, and then the horizontal wrinkles like this, and then the verticals in this area that you will see as well. And that is a combination of the muscle plus the atrophy and the changes in the volume. And one of the things that I'll tell you is, before we didn't talk about this, but more and more we're talking about how the volume changes in our face.
Right, and I think that's very important to note. So how does the volume change?
Yes, we age. There's different compartments in our body, and there's different compartments of fat. There will be compartments of fat in this area, in the malar region, in the buccinator region as well. There's the submental fat pad, and all of these, you know, originally when they're nice and centrally located, eventually they start descending, and as they start descending, we start noticing that there's lines that start forming, like the Marionette's line that will form in this area. You'll see it also in the nasolabial folds in this area, and then you will see how you have the sagging. If the fat falls from this normal compartments that they're here usually in the eyelids, and they start descending, then you start seeing these bags, and people say, oh, I have bags that I didn't used to have before. But it's the fat has always been there, it's just that it's descending.